Closer to home, there was a protest in East Hamilton today over a private plasma donation clinic that's paying people for their blood. Critics say it violates provincial law and undermines public health care, but supporters argue it's necessary to meet Canada's growing medical needs. Roger Collins is live outside the Greifel's donation clinic. What can you tell us, Roger?
Matt, those who are protesting this clinic off of Barton Street East say the government's allowed a dangerous loophole to fester, one that puts profits before patients. And earlier today, their message was loud and clear. Dozens of protesters gathered outside the Greifel's plasma donation clinic on Tuesday, some holding signs, others carrying a life-sized effigy of Premier Doug Ford.
They call it a donation site, but it's a harvesting site where they pay people for their plasma.
The issue of for-profit blood donation has been top of mind in Hamilton since June, when City Council declared Hamilton a paid plasma-free zone.
The for-profit plasma industry targets racialized and disadvantaged neighborhoods, drawing from folks who are living in chronic poverty.
Officers, I'd like you to arrest those people in there. They are violating the Ontario Voluntary Blood Donations Act. They are paying people for plasma. It's against the law.
I'm not here for that.
But I think you should be. That's the concern that we have.
According to the Ontario Voluntary Blood Donation Act, Canadian Blood Services can pay for blood in extraordinary circumstances, but makes no mention of using third-party agents to do so.
It is illegal to pay for blood, for plasma in this province. It should never happen. The fact that we're here talking about it is ridiculous.
And as for comment, Canadian Blood Services told CHCH News that it and Greifel's are establishing Canada's first domestic supply chain for immunoglobulins, ensuring these life-saving medications are made in Canada exclusively for Canadian patients. It adds that the partnership is a response to the ongoing global shortage of immunoglobulins and aims to increase Canada's self-sufficiency, reducing reliance on the U.S.-dominated global plasma market by using plasma collected within Canada. But those rallying today say the need for for-profit clinics is part of a ploy from the Ford government.
Done it with corrections. They've done it with HPD. They strangle out public services until they can convince the public that private is the better way to go.
All the while, plasma from unpaid donors currently covers just 17% of the demand for immunoglobulins in Canada. Now, earlier today, I was here when someone was trying to access the clinic and make a donation, but it was closed. When I emailed Greifel's and asked why, all they said was people have a right to protest peacefully. As for the Doug Ford government, I reached out to his office for comment on the matter, but they did not get back to me by my deadline.